Welcome again to another video, and in this video we're going to discuss the normal appearance of the alveolar crest bone in the anterior teeth, upper and lower teeth, as well as discussing the way of measurement of the alveolar of the distance between the alveolar bone crest and the cemento-enamel junction to determine whether or not the tooth is affected by periodontal disease. So as you can see here in this periapical radiograph of central incisors and lateral, and shows an impacted tooth. Actually, we're not interested in the impacted tooth for this in this particular radiograph. What we are more concerned about is the appearance, or how to understand the appearance of a normal alveolar bone crest in the anterior teeth. So if you have a look at the alveolar bone crest, which is located between the two central incisors in this radiograph, you will see that the alveolar bone crest, unlike in the posterior teeth, would assume pointed triangular shape appearance. As you can see in this radiograph, see the normal that is healthy, let's say normal alveolar alveolar bone crest would assume this triangular pointed appearance, and at the tip of this alveolar bone crest you expect to see, in a normal situation, you would expect to see that the alveolar bone crest is homogeneous, of normal radiographic homogeneity, no pitting, no irregularities in the area. This is a normal appearance of the alveolar bone crest in the healthy in the anterior teeth. Another radiograph which shows us the normal appearance of the radiographic appearance of the alveolar bone crest between these two central incisors. Again, the same appearance is seen, pointed, knife edge. Sometimes it's described as a knife edge appearance, pointed appearance of normal homogeneity. There is no pitting, no irregularity, no loss of continuity. This is what we expect in the normal appearance of the alveolar bone crest in the upper and lower anterior teeth. They share the same radiographic appearance. Another equally important point that needs to be discussed, and when it comes to the determination of the health or disease status, radiographically speaking, of the alveolar bone crest in the anterior teeth, is the level of the alveolar bone crest. Normally, a normal alveolar bone crest should extend a distance between 1.5 millimeter to 2 millimeters from a line, two lines actually, from the distance between two lines. As you can see in here in this radiograph, just like we did in the posterior teeth, we always do it in any area of the mouth, regardless of the position. First of all, we connect the two cemento-enamel junction of two adjacent teeth, and then we would draw a line that passes across the alveolar bone crest. In this case, the tip of the alveolar bone crest, because it is more of a knife edge. Now, those two lines normally in a normal periodontium should be parallel. So if the alveolar bone, if the line connecting the dentino-enamel junction slants towards with either side, the line of the alveolar bone crest should also follow, keeping the parallel relationship between those two lines. The distance between the cemento-enamel junction on the distal side of the tooth, I'll just show you in here, should be, as you can see here, this distance should be measured separately from the distance on the mesial side of the tooth from CEJ to, as you can see here, from CEJ to the alveolar bone crest. These areas are separate, as you can see. Each is measured separately to decide the distance between the CEJ and the alveolar bone crest. But the lines between the CEJ, connecting between the two cemento-enamel junctions of the adjacent teeth, and the alveolar bone crest should at all times be parallel. Which, I mean, if the teeth would be affected, like drifted or tilted towards one side, the relationship remains the same. Those two lines should always be parallel, and the distance between each side, medially and distally, should maintain the 1.5 to 2 millimeter distance relationship. In this case, radiographically, we would say that there is no bone loss. Of course, here we cannot determine whatsoever the condition of the gingival tissues clinically, because this would never appear in the radiograph. The whole thing that the radiograph actually can show, however not perfectly, but in its best case scenario, is whether there is a loss or more than 2 millimeter distance between CEJ and the alveolar bone crest, and it will also show the type of the lesion that is occurring at the alveolar bone crest, so that we can determine whether this is a chronic or a acute condition.